Interesting cases by Khadija and Reham. Please, Khadija, join us.
I'm Khadija Omar, radiology resident at Ain Shams University Hospitals. This interesting case is supervised by Dr. Wissam Shireen and Dr. Ahmed Abul Huda. A 30-year-old female patient with history of transsphenoidal pituitary macroadenoma excision 1 month ago presented to the ER with attacks of severe epistaxis of 2 days duration. All ENT measures to stop epistaxis failed, and the patient continued to bleed and developed hemoglobin drop reaching 6 mg per deciliter. Transsphenoidal surgery has complications including vascular injury and nervous injury and also intracranial infection. Among these, the most serious complication was internal carotid artery injury, which has a very high risk of mortality and disability. Diagnostic, the angiography shows left internal carotid artery cavernous segment tear evident by active extravasation. Balloon test occlusion was positive as the patient had left A1 segment was hypoplastic, so internal carotid artery sacrifice carried certain risk of stroke, so the decision was made to use graft stent. A procedure, guiding catheter was placed at the proximal internal carotid artery, not shown in the image, and the intermediate catheter was placed at the petrous segment of internal carotid artery. Then microcatheter navigated over a microwire placed across the injured segment, the cavernous segment of internal carotid artery. A graft stent was deployed across the injured segment. Control angiography before removing the wire showed no more active bleeding. Final control angiography shows no more active bleeding. And the patient clinically, the epistaxis stopped and her hemoglobin rose back to normal. She was discharged home.
Thank you, Khadija. And it is quite a paradox when we say the balloon occlusion test is positive. Positive in balloon occlusion means that the circulation is not working. So we move to Reham.
Second case is supervised by Dr. Mustafa Farid. It was a 37 years old female patient, medically free, presenting with facial swelling. 37 years old female patient, medically free, presenting with facial swelling, double vision, and occasional headache of long duration. She was diagnosed with left temporal venous malformation and was coming for angioembolization. This is the case. Digital subtraction angiography was done first. What was expected to be seen in the intracranial venous phase? The normal venous flow, cortical veins, the sinuses, we get transverse, sigmoid, internal jugular. What was actually seen? An unusual pattern of venous drainage together with hypoplastic left lateral venous sinus and segmental stenosis of the right transverse sinus. So an MRV was then ordered that confirms the diagnosis. So instead of angioembolization, the patient underwent venous stent placement in the right transverse sinus with significant improvement afterwards. If she had underwent angioembolization, كانت ممكن يعني يحصلها venous insufficiency. So this is picture after. Take home message, and it's important to search for the cause behind a certain clinical presentation whenever possible. Thank you.
Thank you, Reham.
Thank you for Dr. Khadija and Dr. Reham, and I hope, inshallah, they will be the coming professional neurointerventional radiologist. Thank you for all attendees. Thank you for chairpersons, Professor Wael Shawaf from military. He is one of the best professional working in neurointerventional, and all the speakers from Shams and chairpersons and all the attendee. Now we'll close the session. Thank you very much, and we'll start the other session of intervention, body interventional radiology. Thank you very much.